Good evening, Shraddha. Reshma. So, Reshma, are you there? So, Reshma, are you ready to present the station today, right? Dr. Reshma? Mm, Let me check. All of you, can you check your mic now? Akansha, now check your camera. I have unmute all of you, my dear. I don't know where problem. Yeah, I have messaged team, so he's changing. Then you can change all of you, okay? Akansha, then you can open your camera. The team is changing setting. Yeah, Reshma, wait 2 minutes, okay? Now, Kansha, you can try. Reshma, can you unmute yourself so I will see?
Yes, yeah, okay.
Yeah, now is okay. Na?
Yeah,
Akansha, you
okay.
can try now. Akansha?
Hello.
Yeah, hi.
Yes. Yeah.
Hello. Hi.
Okay. Okay, so this is Dr. Gauri with you all, and today I will take this MRCOG coaching series 3. So today we will discuss one case. Dr. Reshma will present, and Dr. Akansha will be the role player. Let them to complete the station first, and at the end, if anyone is having any query, any questions related to topic and related to exam or anything they want to discuss, so at the end we can discuss 5 to 10 minutes. Will that be okay with you all?
Yes.
Yeah, that's good. So I will start your 2 minutes. You can take exactly your 2 minutes. Read the instructions very carefully, okay?
Okay.
And after that, I will start 10 minutes, okay?
Mm-hmm.
So your 2 minutes.
Shall I start?
Still you have 40 seconds, my dear.
Okay.
Yes, start please. 10 minutes started.
Hello, I'm Dr. Reshma. I'm one of the obstetric registrars in the preconceptional clinic. Am I talking to Mary John, 30 years old?
Yes, doctor.
Okay, may I call you Mary? Is that all right?
Yes, that's fine.
Okay, so Mary, I understand from your case notes that you have undergone a bariatric surgery previously and then you're planning for pregnancy. Is that correct?
Yes, doctor. Yeah,
Okay, so in the next few minutes, may I ask you a few questions and then I will address all your concerns and come to a safe, acceptable, and mutually agreed plan. How does that sound to you?
that's fine, doctor. That's fine.
Okay, so Mary, tell me, when was your bariatric surgery done and how did you come up to it?
So doctor, my BMI was always at the higher end. I was 42, and I tried all the methods, but it wasn't just working. It was
Okay.
taking a toll on my mental health as well. So I
Okay.
just was advised for a bariatric surgery,
Mm-hmm.
and so I got that done a year back.
Okay.
And
Yeah. So, do you know what kind of surgery you had, and are you on regular follow with your bariatric surgeons and the dietitians?
yes, doctor, I'm
Okay.
on regular follow-ups, and however,
Mhm.
I'm not very sure what surgery exactly was done.
Well done. Okay.
But
Mm-hmm.
I've been on a regular follow-up, and my last visit with the surgeon was around 4 months back.
Mm-hmm. And you've never had any complications during the post-op period or any nutrient deficiencies for which you were admitted or anything like that?
No, doctor, after the surgery, everything has been fine.
Okay. Are you on the vitamin supplements, the nutrient supplements?
Yes, they have given me some vitamin supplements, and I'm having them regularly. And at present,
Mm-hmm.
I don't have any issues with that. So
Okay.
when I told my pediatric doctor about I'm planning to take a pregnancy,
Mm-hmm. Mm-hmm.
I was told that I should go and see my gynac and take an
Mm-hmm.
advice for that
Okay.
before I
Okay.
take pregnancy. Yeah.
Mm-hmm. And from the notes, I understand that you're also asthmatic. Is that correct?
I've got
Mm.
asthma,
And
so
you
I
were
got
on the
diagnosed.
inhalers? Yeah. And on
Yes,
your
doctor.
steroid tablets, right?
Yes, doctor. I've been given some medicines in terms of inhalers and these steroid tablets, and I'm doing
Mm-hmm.
pretty well with that. Yeah.
Okay. And when was your last flare up?
I was hospitalized around 3 years back.
Okay, that's good to hear. Okay. And what about your last menstrual periods?
Doctor, I think I had my periods 2 weeks back.
Mm-hmm. Okay. And your periods are regular?
Yeah, I've been always on regular periods.
And you've been trying to conceive for some time?
Yes, yeah.
Okay. And no problems with sexual intercourse. Sorry to ask that.
No, everything is fine. We're just trying to
Okay.
have a baby.
Okay. Okay. Can I ask if do you have any other medical conditions other than asthma?
No, doctor.
Okay.
Everything else
Any,
is
fine. Any surgeries on your tummy or down below?
fine. No.
Okay. And you've been up to date with your smears?
Yes, I've been up to date with my smears
Okay.
and everything is fine. Yeah.
Okay. And I believe that you're not taking any other medications or any contraception, right?
No, I'm trying for pregnancy, so no
Yes, I
contraception at the
understand.
moment.
I understand. Any allergies to any medicines or substances?
No, doctor.
Do you smoke or drink alcohol? Sorry to ask, any IV recreational drugs?
I do smoke, doctor. I take
Mhm.
around 5 to 10 cigarettes every day.
Okay, okay. So as we're planning for pregnancy, you understand that smoking has a ill effect on your pregnancy as well as your general health. So if you would like trying to quit, I can connect you to the NHS Stop Smoking Services. Okay. Is that all
Yeah,
right?
that would be good.
Okay.
Yeah, that would be a good idea because nobody has ever
Mhm.
told me about that, however.
Okay. That's good to hear. Okay. And any family history of a concern?
No, doctor.
And your current height to weight ratio?
Right now I'm 28 after the surgery.
Oh, that's good. So you've had a quite stones you've lost, right?
Yeah,
Okay,
it
okay,
was quite nice
okay.
after
And
seeing.
about your blood group?
I am O positive.
Okay. And how are you supported at home? At whom do you stay with?
Oh, my partner is very supportive, and we are looking forward to having a baby. So
Okay,
yeah.
that's so good to hear. So I appreciate you at the outset, Mary Johnson. You've come to get an expert advice before planning a pregnancy. So,
Mm-hmm.
and about planning pregnancy for you, because we had a bariatric surgery, there are chances that we can have nutrient deficiencies and rapid weight loss in the first 1 year. So
Okay.
we recommend being pregnant 12 to 18 months later. Okay, so
Okay.
when you're planning to
Okay.
conceive, we at least ask to take folic acid at least 1 month prior to conception. Okay, and once
Mm-hmm.
your
Okay.
bariatric surgeons and dietitians have given a green flag, we can try to conceive. Okay, that has been
Okay.
done in your
All right.
case. And also because you have
Mm-hmm.
asthma in pregnancy, in one third of the women, it can deteriorate. The condition can deteriorate. One third of the women can, remain the same, and one third of the women can improve. Since your last flare up was 3 years back, I'm not expecting a very severe flare up this time in the pregnancy, but please continue your
Mm-hmm.
medications. But I understand that you're
Okay.
taking steroid about 40 milligrams daily. So studies
Mm-hmm. Yeah.
do show that there is a very slight risk, about 0.3%, 300 women may have kids with
Mm-hmm.
or children with problems of cleft lip and cleft palate on steroids. Okay.
Okay.
I'm not
Okay.
scaring you, but I'm being open and honest with you what the rare risk is.
Mm-hmm.
Okay.
Okay.
And
Okay.
also, because of bariatric surgery, when we go forward in your pregnancy, there are chances that your blood sugars, your baby can grow small. So we're going to keep a close look on the baby's growth. Okay.
Okay.
And there are
All right.
chances because of asthma that you can go into early labor. There are chances that you will have high blood sugars because you're also on
Okay.
steroids. So we'll have to take care of
Right.
that
Okay.
in pregnancy and in labor too.
Okay. So, doctor, do
Okay.
I need to wait more right now before trying to conceive, or I can go ahead and take folic acid and start
And
trying
now
to
it's been
conceive?
about 1 month, right? Yes.
Mm-hmm.
So I would,
1 year.
yeah, 1 year now. So we ideally recommend 12 to 18 months after bariatric surgery.
Okay.
Since you have never
Mm-hmm.
had any complications, you're on well and regular follow up. So I can recommend you to get pregnant in, 3 to 6 months. That will be fine.
Right. Okay.
Okay.
And how will
So
be my pregnancy taken care of
yeah, yeah.
thereafter?
So you will be taken care of by in the consultant-led unit because yours is a high-risk pregnancy, and will be
Mm-hmm.
a team of doctors, which includes myself, the consultant obstetrician, the bariatric surgeons, and the dietitians. The GP, the counselors, as well as the specialist nurses and midwives will also be associated. Okay.
Okay.
So first and foremost, we'll be doing your booking blood test. We'll be doing your nutrient screening for low hemoglobin. If you can have chance of micronutrient deficiencies or
Mm-hmm.
low hemoglobins, that is low blood levels. So we'll be looking at it
Okay.
every trimester and frequently. And we'll be looking
Okay.
at your NT scan, your Down syndrome screening, and then the mid trimester or the head to toe check for the baby as usual.
Mm-hmm.
And then from
Okay.
28 weeks, we'll be doing a serial scan to look how the baby is
Okay.
growing, to make sure the baby is not
Mm-hmm.
growing small. And also, you
Okay.
have high risk of developing high blood sugars. So
Right.
we won't be giving you the usual test, which is called the 75-gram glucose tolerance. That is done
Okay.
for the normal women. For you, there can be something called dumping syndrome, wherein it depends upon the surgery that you had actually. So
Okay.
we might just test your fasting blood sugars and your 2 hour postprandial, that is your sugars after you eat, maybe for
Okay.
1 week and see how you're going. And if you're diabetic or not, we'll check like that instead of the
Okay.
75-gram GTT. Okay.
Okay.
And
All
then,
right. Okay.
yeah, and we'll be monitoring you and we'll make a plan for your delivery by 36 weeks. We can have a vaginal birth unless there is any contraindications for vaginal birth. In case we'll think of C-section in that time. And then we'll make
Mm-hmm.
a plan by 36 weeks. And during labor, we might give you the high V steroids because you've been having
Okay.
steroids for a long time. We'll need to monitor you, and because we don't want you to go in for a crisis, something that we call, because pregnancy itself is a stressful condition, and then when you go into a
Mm-hmm.
lot of stress and you've had steroids all the time, you might have something called as adrenal crisis. So we'll be giving you the IV steroids also to monitor your blood sugar levels and keep you in stabilized. Okay.
Okay.
And you will have
Okay.
one-to-one midwifery care. We'll take care of the baby's fetal heart. And after the delivery, we'll make sure that you don't bleed. We'll do active management of your third stage. That is, we'll give you any medicines to combat any bleeding. We'll make sure the lactational specialists and the midwives are there for helping you with breastfeeding. And if you
Mm-hmm.
require, we can even connect you with the contraception and contraception clinic later on. So that's all once you get pregnant and then deliver. We'll
Mm-hmm.
refer you and keep you, give you the support as and when the need arises. Is that all right?
Okay. Yes, doctor.
Okay.
That's
So, do
fine.
you have
That's
any other
fine.
concerns, Mary? Have I gone through everything, or do you want anything else to be reminded or spoke to about?
No, doctor, everything is fine. Just was asking that regarding my breastfeeding, because I've
Mhm,
undergone a surgery for the
mhm.
bariatric surgery.
Yeah.
Will my baby have nutritional deficiency thereafter, after the delivery? I mean, do I need to get in touch with any specialist prior when I'm pregnant?
Mhm.
For
We'll
you
definitely,
know.
of course, once you are admitted, we'll keep a neonatal alert. And once your baby is
Mm-hmm.
delivered, your baby will be taken care of by the neonatal specialist, okay, specialist baby
Okay.
doctor. Of course, when you have micronutrient deficiencies, if you develop during pregnancy or low
Mm-hmm.
hemoglobin, there are chances that the baby can also be affected. And the labor can also
Okay.
be affected, and you can have early labor, and all that can happen if you have any problems, if you develop any problems.
Okay.
So if that
Okay.
occurs, of course, we will make sure that baby doctors take care of that. Okay.
All
And
right.
once you
Okay.
deliver, we make sure that you will assess you for the need of the blood thinners according to your BMI and according to how the surgery is, how the labor has taken place. And then we'll
Okay.
assess you for starting you on blood thinners or not. Okay. So I'll
Right.
give you some
Okay,
patient
doctor.
information leaflet
Mm-hmm.
and some support groups. And I'll connect you to support groups. Yeah.
Okay. All right. Thank you
Okay.
so much.
Yeah. Thank you.
Thank you. Thank you so much, Dr. Reshma. Thank you, Akansha, for such a nice role
Thank you,
player.
ma'am.
And thank you, Reshma. You completed your station on time. You took 30 seconds of extra, but that is acceptable. So, yes, first tell me, how do you feel about your station?
Um, Ma'am, I feel okay. I mean, it was a little tough because it's not a usual station that we encounter. So I had to
Mm-hmm.
think a lot, and
Mm-hmm.
I think my flow was not
Because
very
there are two
good.
topics in one station.
Yeah,
So
asthma
you
in
need to cover
pregnancy
in both
and
ways. Yes.
yeah. So I did forget about preeclampsia, the chance of preeclampsia in asthma in pregnancy. So the
Yes.
yeah, monitoring blood pressure and urine and protein. So I forgot that.
Mm-hmm.
So it was a
Mm-hmm.
little jumbled up in here and there. So
Mm-hmm.
yeah.
Yes. Anything else would you like to add?
Um, I think I should have. I mean, given the patient also, I tried to make sure that the patient is understanding, but I can uh,
Yes.
improve on that
Still,
because
you
I
are
can
running
ask
little
them
bit fast. Yeah.
fast. Yes,
Because in your mind, time was supposed to be over and you have to cover a lot of things.
yeah,
So in the middle of the station, you are running fast.
fast.
And
Yeah.
after every few sentences, only just to ask the patient
Yeah.
that are you with me? Do
I
you have any question?
yes,
Yes, yes,
yes,
Dr.
ma'am. I
Kansha.
just want to ask, just want to add that in the information gathering, Reshma, when you were taking my
Yeah.
information gathering about asthma, you took, but so bariatric surgery you took, but asthma, you didn't give me a chance to like speak. So what are you? Can you tell me more about your asthma? So I would have been like,
Mhm,
well, I got diagnosed 10 years back, and then I'm on this medicines, and
mhm.
instead of asking me whether what inhalers or medicines you are, you just told me you are on this and this. And when did you meet your last asthma doctor? That was missing in
Yeah.
IG, I think.
Yeah.
Yeah,
Yeah. Yeah.
I
I think I
missed.
didn't. Yeah.
Yeah.
Yeah. I should have asked when was the last visit to your respiratory physician. Yes, I didn't ask.
Yeah, I like the open-ended questions like we practice later, like
Hmm. Yes.
else other times also, like so tell me
And
Yeah.
more
once
about
you
your
will,
condition. What are
once
your
you will
expectations
ask the
from the
open question, it will
consultation?
save your time.
Yeah. True.
Yes.
Mhm.
Mhm.
Yes, Akansha,
What are your
Manpur, anything else?
expectations? Yes, ma'am. I think the I think the patent line with the pre-conception counseling could be. So, what are your expectations with the consultation? So, the role player will come up with something that's what I want to get discussed, like till delivery
Yes.
or like during labor or something.
Mm-hmm.
Otherwise, she did well. She did really
Ma'am,
good.
can I just take a leave? I'm actually at work. I will listen to the recording and to your feedback later on. Is that all right?
Yeah, that's fine. If you
Okay.
want
Thank
just
you.
few things, just I want to add
Yes.
whatever the missing things,
Yeah.
then I will explain the full detail.
Yeah, and
So overall, your performance was good. The only thing is that we have to work on our speed. Okay, here you are running fast and try to ask the open question. Once you will ask the open question, role player half of the story role player will give you. And then in that way, it will save your time. This is one thing. And few things in your applied clinical knowledge was Miss Reshma. So I will show the slides in the group with the students, and then later on you can see where were our lacking points, because in view of asthma, some management, antenatal intrapartum in view of medications. Like some of the medications we need to avoid in the intrapartum period in patient with asthma because of risk of bronchospasm.
Mm.
Okay,
Yes, ma'am.
so that point was missed in your station. And postpartum, yes, breastfeeding, contraception, VTE risk assessment, and when you complete the information gathering, then you can ask, thank you for sharing all this information. Would you like to add anything else, Mary, which will help me in the management? This is important question, and examination part is missing here, at least because she is asthmatic patient. At least we have to examine her chest also, and after that you would explain that what is her background knowledge, what she know about the effect of asthma and effect of bariatric surgery once she planned pregnancy, and how the pregnancy will affect on her condition. Ask background knowledge, and after that we need to ask about management like MDT, and then antenatal, intrapartum, postpartum, then coming back to today consultation, what she will do. So overall, this was the story in the maternal medicine. So I will show. Anybody else want to ask anything or want to add anything? Madina,
Ma'am,
Amrita, anyone?
Ma'am, just I want to
Yes.
ask one thing that since the patient has undergone the bariatric surgery, is there any need for asking about the extra dosage of vitamin D? And also, these patients generally suffer from depression during the pregnancy, so any sorts of psychiatric counselor, and also a need for an aspirin. Is there any need, or after the bariatric surgery, it is little bit different that we don't need to ask about these things? And the bronchial asthma also causes preeclampsia, this preterm delivery, low birth weight baby, and also the less amount of weight gain for the mother. These things I found,
Yes. Yes.
yes, to be.
Asthma, because here there are
And
two
ma'am, you told
condition
about
in
this
one. Yes.
medications
Yeah.
to prevent the bleeding, that oxytocin, the symptometrin, these things need to be used with very much cautions, or else it
Yes.
can
Yeah.
precipitate the attacks.
Yes. Yeah. That's why I
because
told that intrapartum part of medication part was missed in this station. She didn't cover
Ma'am,
the
but,
intrapart. Yes.
ma'am, but in asthma, I think we need to avoid just prostaglandins. Oxytocin can be used.
Prostaglandin we need to avoid, but in view of the risk of preeclampsia, if she develop preeclampsia or hypertension, then
Argometrin also, ma'am.
ergometrin we
Hmm.
need to be cautiously. It is written in the talk, need to give in the cautiously, not absolutely contraindicated, but cautiously we have to use ergometrin. But prostaglandin F2 alpha is specifically caused bronchospasm that we need to avoid in patient with asthma.
Carboprose needs to be, ma'am, carboprose
Yes,
needs to be avoided. And
yes,
rest,
F2 alpha,
if she
yes.
develops PIH, then we
Yeah,
can
if she
avoid
develop hypertension, yes.
ergo.
Yeah,
Yeah.
yes. Anybody else want to add anything? Then I will show you the full key,
Also,
but I
ma'am,
want
one medical jargon, medical
you
jargons
can
for
open
you.
your camera, my dear, so it would be easy in the interactive session I want. Can you open the camera to see your face?
Yes, ma'am. I think one thing, one medical jargon was also used, like active management of third stage of labor has to
Yes.
be done. I think we should avoid that
Active
words as well.
management she mentioned, and cleft lip, cleft palate. Patient don't know what is cleft lip, cleft palate. So
Structural
anyone
defect of
can
the
tell
lips
me?
and the palate. Well, it
Yes.
has a small, the taking this medication can have a small risk of developing a structural defect involving the lips and the palate of the baby. However, it will be
Yes.
taken care of by doing an anomaly scan and screening the
Yes.
baby for defects.
Yes. So don't use the word specifically cleft lip and cleft palate, but yes, structural and developmental defect of the lips and roof of the mouth. But don't worry, it if in case it will happen, then there is minor surgery, so your baby can be fine after the surgery if at all this thing happen.
Okay.
Yeah.
And ma'am,
Anyone else?
like 40 milligram dose of steroids does put her at risk of diabetes.
Yes. That's why she
And so, but
mentioned
this
usually we are
mentioned
going
dumping.
glucose.
Mhm.
Yeah, she mentioned that one. She
Yeah,
mentioned
yeah,
that because of risk of dumping, so we have to go for the fasting, then followed by 2 hour postprandial for 1 week
yeah.
from 26 to 28 weeks onward. Yes.
Okay.
Anybody else? Ahmad,
Yes, ma'am.
you want to add something?
Sana, no, ma'am. Thank you.
Okay. Okay, thank you so much. I think she left, but anyway, overall it was a good performance. But let's discuss together because here are two stations. So I would suggest one point in maternal medicine because we all know that maternal medicine is a very huge module. Okay, sometimes the station are coming from the preconception, sometimes in early pregnancy, or maybe sometimes from 32 or 34 weeks onward if patient is diabetes or uncontrolled diabetes. So overall, one suggestion, try to ask open question in these cases. Once you will ask open question like here, you would say that, hello, my name is Dr. Reshma, one of the doctor covering the preconceptional clinic today. May I confirm your name and age, please? I can see in your notes that you have done a bariatric surgery and you are having asthma. And today you are here because you are planning for pregnancy. So if any patient is preconceptional counseling, first we have to appreciate the patient in these cases. I would really appreciate that today you came here for counseling. Once the disease is well controlled, we can get a good outcome for the mother and as well as for the baby. So I really appreciate for that today you are here for the counseling. So tell me more about your condition when you had bariatric surgery. First, bariatric surgery detail. Then once she will explain everything, then ask, okay, I can see in your notes that you are having asthma. Can you please tell me more about that? So let's patient will explain. Then what are the missing points from the patient side? Then we have to add those points in our history of presenting illness. Am I clear so far, Ahmed, Omia? Hmm? Are all
Yes,
of you
ma'am.
agree
Yes,
on
ma'am.
this?
Yes,
Yeah,
that's true.
Yes.
Ruxana, Poonam. Okay.
Mm.
So first ask
Yes,
the
ma'am.
open question. Yeah. Then rest of the history template
Mhm.
you need to cover from both point of view. Bariatric surgery and asthma. Both you need to cover. And once you complete the information gathering, here she covered rest of the points. She asked contraception, Pep smear, drug history, smoking, alcohol. She signpost when she asked, support she asked, allergy, blood group she asked, but she didn't ask the reservation of blood transfusion. That is again one of the important point
Mm.
in those patients who are planning for the pregnancy or who are coming to you during the pregnancy. So reservation is also one of the important patient safety point which we must ask in these obstetrical case. One of the other point that once you people complete information gathering, so it should be
Sorry,
in the
ma'am.
sequence.
Can I
Yes,
ask
my
a
dear.
question? What is the benefit of asking about blood and blood transfusion in a case who come for antenatal care or preconception advice?
Okay. If any patient is coming to you for preconception or antenatal care, for example, diabetes case, for example, hypertension, for example, she is multigravida patient. What do you think? Is there any risk of
Mm.
PPH?
Yes, it is. There is a risk of BPH, but I will ask her about this in the third last minister last third trimester.
No, you have to ask from the preconception. Why? If any patient is having a Jehovah's Witness or any reservation, so you have to document that information in the notes. If something happened during pregnancy, how you know that during pregnancy maybe your patient will develop APH, your patient will develop preeclampsia, this placenta previa or placenta abruptio. If she
Okay,
is known case of hypertension, is there any risk of abruption, right?
okay, doctor. Yes, yes,
Because
yes.
if she is having a reservation for blood transfusion, then at least we can ask if in case of life threatening condition or if in case any emergency situation or in case you are having a reservation only for blood transfusion, but what about other blood products if need arise? So at least we should have a
Mhm.
clear management plan once she will come in the antenatal period to us. So if she's having reservation or anything, if you have documented the notes, if something happened, we will be alert at that time what to do in that situation. How many team members, which MDT team members you need to involve in that situation. Got it?
Got it.
Clear?
Thank you, doctor. Yes, yes, clear. Thank you.
Thank you, my dear. So now coming back to this, yeah. So first of all, when you start the information gathering, specifically today, I'm discussing about the maternal medicine. Okay, so maternal medicine first, whatever the case you will get in the exam, whatever the case, first complete the introduction, then HOPI of that case. After that, complete the rest of the information in sequence. Don't jump here and there. Okay, first obstetrical history, then if preconception she is coming to you, then we have to ask about last menstrual period, contraception, pap smear. And whenever you people are asking about the pap smear, make sure what is the age given to you in the exam, because sometimes our template in our mind and we forget to check patient is 24 years and we are asking are you up to date about say pap smear. So be careful what is the age is given to you. If age is more than 25 years, then only you have to put this question of pap smear. And contraception, if you are thinking that patient is having a uncontrolled asthma or uncontrolled diabetes or whatever the condition, what contraception history she is giving to you at the time of information gathering. And if her disease is not controlled, then at the end of your discussion, you must discuss the effective contraception. This is again one of the patient safety point until she get a signal from her own doctor to plan the pregnancy. Till that time, she has to use the effective contraception. So you must ask in the information gathering, and if disease is controlled, okay, you can refer her back to the doctor. She can plan pregnancy after having a consultation with her own doctor. But if it is uncontrolled, then you have to, at the end of your discussion, you have to discuss about effective contraception. Then family history is important here. Then come back to social, blood group, BMI, support. So this should be sequence in your exam and you have to work on that. You need to complete the information gathering in maternal medicine in at least 4 minutes and 30 seconds, not more than that. So you people need to practice accordingly, that you need to complete in 4.5 minutes your information gathering. After that, once you complete the information, you have to ask one question at the end. Thank you for sharing all this information, Mary. Is there anything else would you like to add which you think it is important for me? This question will help you if you have missed any important point. For example, blood group, for example, allergy. Definitely patient will tell you at the end. If you would ask this one simple question, that thank you for sharing all this information. After that, you have to do examination depending upon your case. And then again, you ask, may I know, Mary, what you know about your condition, how it will affect on the pregnancy? She would say, no, I don't know. Then you have to ask, okay, Mary, most of the time when disease is well controlled, we can get a good outcome for the mother and as well as for the baby. But yes, there are few risks for the mother and few risks for the baby. Would you like to discuss with you? Then you explain. Risk related to bariatric surgery, risk related to asthma, mother risk, baby risk. Once you complete these, and no need to explain all the risk which is mentioned in the guideline, just make sure because we have only 10 minutes here. So you have to mention the risk only 3 to 4 risk for the baby, 3 to 4 risk for the mother, which you think it is important in view of your case. So after explaining this 3, 4 risk, then you come back to the next point. Your care will be with the group of specialist doctor. So not only mention the group of specialist doctor, but you have to enumerate the name of those team members. Like here, I think Reshma didn't mention the name of those members. So you would say your care will be with the group of specialist doctor in which I will involve your bariatric surgeon, your physician, respiratory physician, GP, counselor, my consultant, obstetrician, baby doctor, and pain doctor. And along with if need arise, I will arrange a, as you mentioned at the end, because these patients might be, I don't think so, someone is asking about the psychiatrist counseling, I don't think so in this case if need. But yes, if you are thinking that patient is upset and patient is worried, then you can arrange some counseling sessions for her. Otherwise, routinely, I don't think so in bariatric surgery in asthma we would not arrange any psychiatric appointment, no. Okay, so after enumerating the name, then you explain what you will do in the antenatal, intrapartum, postpartum journey. After completing that all, then come back to today consultation. You have to say, I would start you on the folic acid, and then I will arrange a meeting with your bariatric surgery doctor, your asthma doctor. Meantime, you can discuss with them, and once you plan pregnancy, after getting the green signal from your doctor, you can book your pregnancy under consultant-led clinic. And thank you for sharing. Thank you for giving me your time. So see you again in our next consultation along with my consultant. Thank you so much for giving me your time, Mary. So this would be the full template of maternal medicine from preconception till postpartum period. Am I clear, everyone?
Regarding her green signal for taking pregnancy at the moment, she underwent the surgery 12 months back. So the least is
Yes.
12 months, at least 12
Yes.
months. So is it okay to give her a green signal right now?
Yes,
Okay.
yes. Because in the TOG article, it is written 12 to 18
To
month, but
18
at
months.
least 12
At
month.
least 12 months,
Because
yeah.
yes, because now her asthma is well controlled and she's already
Mm-hmm.
30-year-old lady. Okay. So
Okay.
she can plan
Mhm.
pregnancy, but again after getting the signal from her doctor. Okay.
Ma'am,
Mm-hmm.
in the
Yes.
obesity guideline, it was written that these patients are highly prone for the depression. Obesity guideline, it was written that these patients are highly prone for depression. For that reason, they might need counselors. So for that reason, I asked things. In
Yeah.
obesity
So
guideline, it
you
was
can,
mentioned.
yeah, I agree with you.
And
If
also, ma'am,
obesity,
mentioned there the chimpanzee of fundal height measurements and from, and also if the Doppler hearing, because of the obesity is not
No, but
possible to auscultate the
this
baby
is
Subanjit,
heart
not a
pulse.
discussion
Subanjit,
of
now
obesity.
her BMI is
Yes.
28 now. After
28.
surgery, she's come
Okay.
28 months.
Yeah.
Okay,
Yeah.
okay, okay.
So now her
So she's
BMI
come
is
down.
28.
Excuse
Yes.
me, ma'am.
Yeah.
Ma'am, ma'am,
Yes, my
I'm
dear.
asking that the green signal is from our side or from the specialist doctor side?
No, from her own doctor,
The green
not from
signal
our side.
for the pregnancy
Yeah. Green
from
signal
her own
from her
specialist
own
doctors.
doctor.
Yeah,
Ma'am,
okay.
who is
Yes.
the own doctor?
From her,
Who will be the
Asthma
own doctor?
doctor,
okay,
asthma doctor
their
in
own
bariatric
doctor.
surgery.
And
Asthma
okay,
and bariatric
as
surgery
they
doctor.
give the green signal, then we can say you can now conclude.
Yes.
Okay, okay.
Okay. See, I will tell
Yes,
you.
ma'am.
Here, your patient came to you for preconception to know what would be the effect of asthma and surgery and medications on her pregnancy if she planned now. Okay. So now your job as an obstetrician, you will explain
Okay.
how will be her pregnancy journey. Got it? Now, if she conceive or not conceive now,
Yes, ma'am.
depending upon her surgery and depending upon the asthma, that signal will be given by her own doctor from where she is following previously, like
Like a
respiratory
specialist.
physician and bariatric
Okay.
surgeon. Got it?
Okay.
And this point you can remember not only on this case, whatever the maternal medicine case. In preconception, if
Yes, ma'am.
diabetic patient is coming to you, cystic fibrosis patient is coming to you, SLE patient, all these, if they are coming to you in the preconception, you have to arrange urgent appointment with their own doctor. Once they will advise, they can plan. Meantime, your job is to ask about folic acid and refer back to her. And one more important thing here, rubella vaccination is important in the
Yes, ma'am.
preconception. Okay. Is she up to date with rubella vaccination? And second thing, she's asthma. In asthma, what other vaccination is important? Ruxana,
Flu jab.
Influenza.
influenza. Yes. Okay. So
Yeah.
these vaccination is important to ask from the patient. Clear now?
Ma'am, if
Yes.
she's taken rubella vaccine, so the gap will be minimum 1 month, no?
Yes.
Or 1 month.
Okay. So if she is up to date, then no need. If she's not up to date, then you can
Yes.
advise her to take rubella vaccination and avoid pregnancy at least for 1 month. Okay, but we have to ask this question in preconception cases.
Ma'am, for all
Thank you, ma'am.
patients,
Thank you.
all patients for preconceptional, when they are coming, we will ask for the rubella.
Yes, 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 for all the patients
Excuse me, ma'am.
for all the patient
Ma'am.
preconception.
Okay. And ma'am, for examination,
Ma'am.
what we will do here? Or we just say
Yes.
we will do examination.
Yeah, examination again,
Ma'am,
it is
at
a
the
very
start
big
of the goal
question.
of the
Yeah, 1 minute. I will complete the answer of this, Dr. Anjali. Regarding examination, see, my dear, regarding examination, sometimes some mentors they are telling that why in the preconception we are doing examination. What is the logic? I agree, totally agree. But the thing is that sometimes what happen, you don't know what is the template in the exam with the examiner. Okay, what key points is given to them. Maybe sometimes they are mentioning only word examination or vitals, but here, because patient is asthmatic, you can auscultate her chest, you can check the current vitals of the patient. So no need to mention that what you will do in examination if patient is preconception. Okay, simply you can say I would examine you in the presence of Sheba. That's all. Because if you would say, even though if it is not in her examiner key, it's okay. But if it is in the examiner key, you will lose your marks. You got
Okay.
my point? And
Yes.
yes, if antenatal cases from 20 weeks onward, you can check the abdominal examination. You can check the fetal heart sound after 28 weeks of pregnancy. Got
Yes,
it?
doctor. Yeah.
So rather
Ma'am?
than not mentioning, I would suggest that we can mention. So now I would show you the key of this one, and if still anyone is having query, no problem, I'm here, don't worry. So as we come to the Reshma points, what she mentioned and what she missed. So type of surgery she mentioned, which type of surgery she asked, but here role player were telling that I don't know which type of surgery was done. So if in that case role player don't know, you can say in the exam, okay, with your permission I will review your notes. Okay, this is again one of the important point. In any kind of surgery, if any kind of things, if patient is telling that I don't know, you would say I would review the notes, okay, with your permission, means after taking the consent. So time of surgery, nutritional she asked, supplement, what supplement she is on, asthma detail she somehow some points she missed and some she asked, medication she asked, obstetrical, gynae, pepsiner, drug, smoking, mental health, blood group, BMI she asked current, but we can ask the before BMI and now what is her BMI examination. And if we come to the confirm the patient safety point, she confirmed the identity. High risk medications, risk of malabsorption, consider optimization of asthma before she mentioned. Warn about the risk of unplanned pregnancy, post-bariatric surgery, avoid pregnancy at least 12 to 18 months. She asked steroid she covered, involve patient in the process, mutually agreed, avoid trigger. Avoid triggering factor. NSAID is important. NSAID we can't give in patient with asthma, pollen, drugs, or if there is any triggering factors, flu, vaccination. That's why we are giving. So cold, flu, exercise, whatever the triggering factors we would avoid in this case. Prostaglandin, as we mentioned, aspirin. So this is all about asthma and this thing. Communication was good. And importance, she mentioned MDT, folic acid, offer preconceptional blood test if need. That is depend upon the case-to-case variations. So here it is your MDT team. So here your MDT, midwife, pediatrician, anesthetist, GP, respiratory physician, dietitian, nutritionist and dietitianist, and also your pediatric surgeon doctor. This is the applied clinical knowledge, contraceptive counseling, education, nutrition status, encourage weight stabilization. That is again very important because sometimes exam role player can ask you because she had done a bariatric surgery to reduce the weight. So sometimes patient is very much conscious that maybe my weight again will increase in the pregnancy. Then again, we have to check the weight of the patient and accordingly we have to explain the patient how to monitor the nutritional status in collaboration with the dietitian. So rubella and influenza vaccinations are up to date. Antenatal again, MDT, bariatric surgeon, physician. In between some of the visit in any kind of medical disorder. Again, remember this point. In any kind of medical disorder cases, some of the visit you need to arrange along with her own doctor during antenatal period also. So it is a conjoined meeting, you can say. Early antenatal consultation, avoid triggers, determine the baseline nutritional status, regular blood test, weight at every visit. As I mentioned, these are the risks she explained. Asthma in pregnancy, she explained. Medication also safe, she mentioned. This is all about the asthma and fasting that we mentioned this one also, how to arrange the glucose test in patient with bariatric surgery, avoid NSAID, assess for thromboprophylaxis, intrapartum. Again, consultant aim for vaginal delivery. If there is no complication, we can wait till the term. And if patient is taking 5 milligram of prednisone for more than 4 weeks, then don't forget to mention the stress dose of steroid during labor. Active management of third stage neonatal care, adequate pain relief is important. Encourage breastfeeding. Review of medication in the postpartum period is important. Contraceptive advice in the postpartum period. Neonatal review again by the pediatrician and nutritionist appointment and follow up with the respiratory physician. Again, if patient is asthma, you can encourage the exclusive breastfeeding also because baby will get more benefit from the breastfeeding in patient with asthma. Yes. Now, anybody is having any question?
Ma'am,
Yes, my dear.
ma'am, if the patient in our task is below 25 years, but however she is sexually active, then we have to ask about the smears.
No. If patient is less than 25 years sexually active, this is your question,
Yeah.
right?
Yes,
No.
yes, ma'am.
Less than 25 years, it is not an indication to ask pap smear. But yes, if patient is, you are thinking, if there is any hidden agenda like multiple sexual partner or high
Okay.
risk case, then yes, you can ask. But routinely, if patient is less than 25, we would not ask.
Ma'am,
Okay,
even
ma'am.
if the
Thank you.
patient is less than 25 years with multiple sexual partners, smears are not done in NHS. They will do colposcopy, but smears we cannot ask because he cannot have smears as per the NHS.
Yeah, that's what I'm telling you, that if patient is less than 25 years, then it is not indicated. But yes, if it is high risk case, then yes, you can ask. But I
Then
would suggest
colposcopy
you,
is done. Yes.
yeah. But again, I would say one simple advice for the exam purpose. See, your case is maternal medicine. It is not a sexual health module. It is not a contraception. It is not a gynae case. I would suggest keep yourself simple in the exam and safe in the exam. Okay. Here,
Ma'am.
your case
Okay,
is
ma'am.
more about asthma and bariatric surgery. Okay.
Yes.
Even though if they are giving you 24 years, just ask, are you up to
So
date
we
with your
stick to the
cervical
module.
cancer?
General question.
Is strict to the module.
Excuse
Don't
me,
jump
ma'am.
here and there.
I'm
Otherwise, you
asking
will
this
be out of
general
your track.
question.
Okay,
Sorry?
ma'am.
Excuse me, ma'am.
Thank you, ma'am.
Ma'am, I'm asking
Yes.
you. There's a general question. Ma'am, can we see in the online examination that I'm going to examine you? I'm very much
No.
stressed,
In
ma'am, because we are
online,
appearing in
don't
the
say.
hall.
Yeah. It is good question because
Okay.
I know that in
What
August,
should we
I
say?
think exam is online going on. Your voice is
Mm-hmm. Yes,
breaking, my
ma'am.
dear, in between. Yeah. I will give you answer of this question.
Okay.
Whoever are appearing
Mm-hmm.
for the online exam, you can skip the examination point.
Great.
Okay. Don't
Okay.
say
Okay.
examination.
Okay.
Otherwise, uh, because I was online, I gave my exam during Osler time, during COVID time. First time they
Okay.
opened
Yes,
this
ma'am.
Osler. So 2, 3 station, I skipped this examination, but one station I mentioned. Why I mentioned? It was in my mind that time. Maybe they have key in any of the station. At least some station I can
Yes,
get
ma'am.
marks.
That's right.
Okay. So I asked. 3
Mm-hmm.
stations I skipped, but 4th station when I asked from the role player, my role player itself told me you can't examine me. It is online exam.
Okay. Okay. Thank you, ma'am.
Directly she said to
Thanks a
me.
lot. Thanks a
So
lot. We are
yes,
thinking from 1 month
Dr.
above, I
Gauri,
can say, that I'm
yes, my
going to
dear.
examine you.
Yeah, so don't ask this
Okay.
question, okay? An online exam.
Okay.
Yeah,
ma'am,
Dr.
how
Farah?
can we get these slides? The slides that you are showing, they are very important, the domain-wise feedback and safety points. So for
Yes.
not all for all the cases we get them, ma'am. Even during ma'am session, these slides sometimes not like this.
Yes, it is my own hard work, no? It is
Ma'am,
my
your
own
own
hard.
hard work from where we will get these things.
Yeah,
So you
it is
start
my
taking
own hard.
sessions for us, ma'am, please.
Sorry?
Your hard work, but it is with RFL logo, ma'am. So please give us, please. What we will do.
Yeah, I'm giving you now with RFL ego. You can go through those, no?
So only few sessions that you will take, we can see your hard work. What about
No,
others, ma'am?
everyone is hard work. Don't worry. We all mentors are hard worker. Don't worry.
We are not doing. Actually, I'm not doing hard work. That's
Dr. Gauri, I have one question.
Yes, my dear.
This folic acid will be 3 months before pregnancy, or 1 month only before
At
pregnancy.
least 1.
See, as
Yeah.
per the dog article, it is written 1 month before.
But usually we recommend to the patients, generally speaking, for
Yes.
all the patients, 3 months before pregnancy
Yeah,
and
usually
3
we are
months
doing
during
this time.
pregnancy.
Yeah. But some dog article, some cases they are mentioning 1 month before, but usually yes, 3 months before.
Ma'am,
But
it
simply,
will be
yeah, yeah,
it will be a high dose folic acid or normal dose folic acid. Since the
normal dose.
patient
Why?
underwent body
No. See, again, I'm telling you here,
BMI
now
is
her
28,
BMI is
ma'am.
normal. Huh?
Normal. Okay.
Yes. So don't confuse yourself and don't mix the case with obesity. Obesity is totally
Okay.
different case. Okay.
Okay, ma'am.
Obesity will be totally different. After bariatric surgery, take your case as she is having a normal BMI. Okay.
Ma'am, we need to advise for vitamin D also
Yes,
in,
it is
in
written
view
here
of
because
bariatric surgery.
see, after bariatric surgery, there is deficiency of all the vitamins, minerals, calcium. So even though if patient is not planning for pregnancy, they are giving this nutrition. Why? Because after surgery, patient appetite is decreased, digestion is decreased, but they need some nutritions, right? Some
Yes.
nutrients they need, so that's why they are giving these medications in the form of tablets and food advice accordingly.
Because ma'am,
Um,
vitamin D,
mhm.
regular vitamin D 400 units, all patients should take. But
10
high dose
microgram.
Yes,
vitamin D,
yes,
yeah, 10 microgram. But high dose
yes.
to be for the specific patients like obese patient, hypertensive, preeclampsia
Yes.
history,
So here, no,
or
see, you need to know
Preeclampsia.
obesity. See, normal dose of vitamin D, you should know. Obesity, how much dose? Preeclampsia, how much dose? And if there is deficiency, how much dose? So these 4 doses, as per the, there is one paper, um,
Ma'am,
scientific impact paper on vitamin D. So there is one
800 and
table.
1000, ma'am.
Yes,
800 for the
yes,
at the risk of deficiency, and eclampsia patient is 1000 and normally 400.
yes, yes, yeah. Oh, 4, 8, and 1000. Yes, you are right. So remember that dose. Clear?
so
Yes,
no,
ma'am.
ma'am.
Any other
In
question?
this specific case, how much dose we should give?
Here it is normal dose.
Okay.
Here, because your patient is already vitamin D given by her own doctor. So whatever the dose they are giving, we have to follow that dose only.
Okay, ma'am. Thank you.
Okay. Any other question? So it is just a start. So there will be weekly sessions by each mentor. I think every 6 weeks term wise it will be. So don't worry. You will be
So,
with me
ma'am,
again.
days are fixed or not? Which day we will do? 3 times
No,
a
no.
week?
It is right now, I think twice weekly. We have started. So today is third session. So I think next session will be by Dr. Sidra and then Dr. Jyoti and Dr. Shabnam. And one more doctor also there. Yes, Dr.
Ma'am, can
Namita.
we
Yeah.
have a schedule? Anything, at least for a week or 2 weeks?
Uh, request Dr. Safa. Otherwise, I will discuss with Dr. Safa this thing. Okay.
Yes. Thank you.
I will
Thank you
discuss.
so much.
Yeah, I will discuss. Then maybe she will share. Okay.
Thank you so much.
Yes, ma'am. That will be helpful.
Okay, my dear. Any other questions? If anything related to maternal medicine, related to this topic, feel free to message in the open Telegram group. Okay.
Ma'am, regarding the asthma, we will ask
Hmm.
about the vaccination of the influenza. And is it needed
Hmm.
to ask for pneumococcal also?
No. See, flu
Only in
vaccination, why
second.
we are asking? Because these patients are at risk of flu,
Yes.
influenza. Otherwise, pneumococcal and all these things only in patient with thalassemia and sickle cell
Sickle.
disease, because those
Okay.
patients are more at risk of developing infections. That's why we are asking.
Okay, ma'am.
One more thing, Dr. Jyoti, sorry, Dr. Gauri. In the real exam, the role
Hmm.
players, they will let us go till the intrapartum care and postpartum care in maternal medicine, or they will just stop us just regarding the preconception care only. Will we be
No,
able to
you
take
need
the
to cover.
station till then?
No. You need to cover, they want you to come, because see, preconception, you will ask only history from the patient, right?
Yes.
Preconception, you will ask history, you will explain about contraception, folic acid, vaccination, right? This advice you will give
Mhm.
if patient is coming to. But this patient came to you in the beginning, if each scenario you will see, in each scenario, explain the management plan, address her concern. Management plan for what? Definitely management plan of asthma in pregnancy and bariatric surgery case after pregnancy. How would be her pregnancy journey? That's why they came to us. Otherwise, why they will come to you?
Yes, ma'am. That's what I'm asking. But the role players, they start asking what will happen to the baby, what will happen to me, and this took all the time. They did not let the candidate go till the intrapartum care. Maximum they can discuss the antenatal care. That yes, the team of doctors will see you, and that's it. They keep on roaming
Okay,
around this.
clear. I agree with you. Now I will tell you how to tackle registration. Once you complete information, okay? See,
Yes, ma'am.
in the beginning, when you made your agenda, that's why I'm telling you, in beginning is very important. That's why I'm giving you these lines, how to ask the patient in the beginning. In the beginning, if you would say, okay, Mary, today I will discuss with you about asthma and bariatric surgery. How will be your pregnancy journey? But apart from that, do you have any other expectation from today consultation?
Yes, ma'am. I did same. And then she said that I have written my questions and I'm here to ask you my questions. And
Okay,
then
fine.
all her concerns were about the antenatal care. That's
Okay,
it.
fine. Okay. Now, for see, main thing in the exam, if patient is telling you, I have all my concern, it is written, I will ask you, that is good. Then your job is easy.
Good.
Why?
Okay.
See,
Yes. Yes. Yes.
exam is only to address the concern of patient. It
That's
is
what I'm
not
asking.
that whatever
Exactly.
in your mind you would explain to the patient. Exam is whatever
Hmm.
in the patient mind, you have to address those concern of patient. And
Yes.
once you
Yes. That.
address all the concern, for example, then you can ask, okay, Mary, do you have any other question? No. Do
Yes.
you want
That's
me to
better.
discuss with you the labor management also? That point you see how much time is remains there. If you are
Okay.
thinking you
Okay.
have enough 2 minutes also, simply you ask, do you want me to discuss with you how would be your labor and postpartum period? She would say no, then okay, no. We will discuss in next visit. Okay, no problem. I really
Okay.
appreciate your concern. We will discuss
So
further
first
in
we
detail
will
in the
answer
next
the role
consultation.
player concern, right, ma'am?
Sorry?
First we will always answer the role player's questions.
Yes,
Yes.
yeah.
Yes. Okay.
Because
Perfect.
sometimes, I will tell you one thing. In the middle of the station, role player will ask you something. Okay?
Yes.
Then some students having habit, they will tell, okay, I will address your concern later.
Yes,
Okay?
ma'am.
Because we
Hmm.
know our template in our mind. We want to complete our template first. But at the end, you will forget the address of that concern of patient. So your station gone because you didn't address the concern.
Yes, ma'am. True. Thank you. Thank you.
Clear?
This was a very important point. Thank you.
Yeah. And one more thing also I want to add here, because of Reshma asked one question from the role player about smoking. Okay. Here, because smoking is again important, because she mentioned that she used to take smoking 5 to 6 cigarettes, something she mentioned, right? So she said, Reshma answer was, smoking is not good for health. I will connect with you at the smoking cessation program if you want. Something she mentioned like these lines. I want someone else how to address that concern. Okay, Farah, you tell me.
Have you ever thought of quitting smoking? In
First ask me
generally
the
after
question, then
my
I will tell you. First ask me the question.
okay. All right. So do you smoke, drink alcohol?
Yes, doctor, I used to smoke around 6 to 7 cigarettes in a day.
And Mary, have you ever thought of quitting smoking?
Why, doctor? Is it necessary for me to quit this smoking? Because it is the only joy of my life.
I understand and I acknowledge your concern, Mary. Actually, just optimizing your health and just cessation of the smoking can not only benefit your general health, but it has a great impact on your entire pregnancy journey as well. So, if you allow, I can connect you to the smoking cessation, NHS smoking cessation program. Just give it a shot, just see if it can help you. Right? What do you think about this?
Okay, doctor, I would let you know. I will think about that. Okay. Thank you, Dr. Farah. So it is it is a good answer what you said, but again, I would just say one line. What I
Mm-hmm.
used to use that time. Okay,
Mm-hmm.
I would say like that. Okay, Mary, I can understand your concern. I'm not going to be judgmental, but I want you and your baby to be safe and healthy. Actually, Mary, in patient with asthma, there are risk of the smoking on the mother and as well as for the baby. And we want your pregnancy to be safe. So what do you think about that? If you can quit the smoking? See,
Yes. Yes.
I cut short my sentence also. I changed
Mm.
my tone also. I was little bit more empathetic with the patient. And I mentioned that I'm not going to be judgmental. What do you think?
You
Is
are
it
saying
right?
that I'm not going to be judgmental. It is not judgmental itself.
Hmm. Because I'm not like it is your life. Okay, whatever you
Yes.
want, it is your life. This is just a
Okay.
simple advice from my side.
Advice. Yes.
If
Okay.
you wish, I
Okay.
can do. If you not, I respect your choice.
Yes. Yes.
And
Ma'am,
one
Okay.
more
after
thing, I would add one more thing in maternal medicine. I want to add whenever you people are explaining the risk, like risk to the mother and risk to the baby, right? Always I noticed what students are doing. They are telling you would have increased risk of high blood pressure, you need more admission, your baby can be good size. I'm sorry to say your baby can die inside the womb.
It is better
We
to
have,
say patients with this disease. They can.
yes. So right sentences is Mary, in patient with asthma or in patient with diabetes, they can have this risk to the mother and this risk to the baby. Don't say you have risk or your baby would have this risk. This is you are pointing to the patient. She will be more scary. Clear?
yes,
Any
ma'am.
other question?
Yes, ma'am. As you tell for the smoking, and we should
Hmm.
ask smoking, like if I will ask, Mary, do you smoke? Then I will get her
Hmm.
answer. Then I will ask, do you take alcohol? Like all three separate
No. If she's
questions.
telling, no, ask in one row, no problem. Few personal question, Mary. May I know, do you smoke, drink alcohol or any recreational drugs? Like that you can ask because here we don't have enough time. Don't ask
Mm,
one.
okay.
Here you can ask this simple compound question also, no problem. If she say
Okay.
yes, I used to smoke, then you can ask, may I know how many cigarettes in a day, Mary? 5 to 6 cigarettes. Okay, I'm not going to be judgmental, Mary, but may I know, have you ever thought to quit the smoking? Because in patient with smoking, there are few risks to the mother and baby if they plan pregnancy. So what do you think about that?
Okay. And we can say
Hmm.
this also, that this smoking can worsen the your condition asthma.
Don't say your condition. Now I say don't pinpoint the patient,
Yes.
not
Okay.
your
So,
condition.
okay.
Okay?
So, in
You can
general,
say
we can say.
smoking would affect asthma, not your
Ah,
condition.
okay. Yes. Okay. Okay. Understand, ma'am. Thank you.
Clear? Would you give aspirin in this case of asthma?
No.
This is again a
But in
big
bariatric surgery, we should give.
no, because as I'm asking if your patient is primary, for example, your patient is primary and previous history of preeclampsia, you would say, or maybe your patient is having a high blood pressure also. Means along with primary patient, there is another risk factor in which you need to give aspirin, but because patient is asthmatic, will you give aspirin?
No.
No.
Then what you
Yeah,
will
but
tell to the
this is the
patient?
baby aspirin.
Yes, yes, baby aspirin only I'm asking. So how to give answer on that question? If patient will tell you, okay, okay, doctor, one of my friend had the same problem. Doctor gave her baby aspirin because they told baby can be risk of small. So what do you think? Shall I take that medication? How will be your answer?
Then we will say, yes, I
Hmm?
can understand your concern. But the thing is that aspirin is generally not safe the patient who is asthmatic. But we will consult your doctor and then we will decide regarding that.
Yes. So you will involve her own asthma doctor. Okay. Your consultant and asthma doctor. Clear?
Ma'am, can you please repeat
Any other
once again
question?
the aspirin? Ma'am, can you please
Hmm?
repeat that aspirin and asthma?
See, for any reason, for example, your case is asthma, okay? But if you find any of the two other factors in which you think that this patient need aspirin also, so in that case, if you think patient is asthmatic and you want to give aspirin because of some other reason like preeclampsia, eclampsia, or some other autoimmune, or patient is primary with twins, in that case, primary with high BMI, if you think that this patient need aspirin, so in that case, you would not give directly aspirin from 12 weeks, but you will arrange appointment with asthma doctor and your consultant. They will decide because in asthmatic, aspirin is avoidable. We have to avoid aspirin in patient with asthma.
Okay, ma'am, how to say to that patient? Can you please tell
Yeah,
once
we would
again
say
those
to the
lines?
patient, if see, first of all, you would not say directly. If no indication, no indication. But yes, sometimes patient, if asked you, then you have to go in that direction. Otherwise, don't confuse yourself in the exam. Okay. Don't say by yourself in the exam regarding aspirin until and unless patient is not asking you. But yes, if patient is asking you, then you would say, I can understand your concern, Mary. Yes, you are right. If patient is having a risk of low birth weight baby, like small baby, in that case, we are giving aspirin to reduce this risk. But as in asthmatic patient, itself asthma, we are avoiding aspirin as per the evidence. But yes, again, I will arrange a meeting with your own doctor also, and I will discuss with my consultant. So accordingly, we will make a safe plan for you. What do you think about that? Okay, doctor.
Okay, ma'am.
Ma'am, in this particular
Dr. Gauri,
case,
you will
do
be
we have
dealing
to
with
start aspirin?
Sorry,
In this particular scenario, it is indicated for aspirin?
you tell me it is indicated?
No,
Tell me. No,
no.
there is no indication.
Yeah, there's no. Somebody has
No,
mentioned that we need to discuss about aspirin like that in the message. So, but here it is not
no,
indicated. No.
no, in this case, not indicated.
Okay, thank you very much.
Dr.
Yeah.
Gauri, you will be taking maternal medicine always?
In these coaching sessions,
Yes, ma'am.
I don't know.
But really nice.
Yes.
Whatever the order from the boss, we will follow that order. But
Ma'am,
actually,
one.
I am taking Salvage sessions, na? So in Salvage, I am taking maternal medicine and teaching. And we are taking one-to-one session also. But now here, because this first time is starting, na? So we'll see. Whatever the topic given by Dr. Safa and Dr. Sidra, we have to follow those one.
So, ma'am, these sessions are for the students who are going to appear in November, like only the free coaching session, or what type of these are? Because I just accidentally joined the link
Ah,
because we are
okay.
appearing in
Keep
August.
taking
Yeah,
the
our class
session,
was
don't
ended
ask.
and
They will stop.
See, we have
Even
started. Now we have started, so it will be, I think, long journey, no?
oh yeah, yeah, okay, okay.
Yes.
It was very nice, ma'am.
Thank you, my dear. Thank you so much.
Ma'am,
Thank you so much.
one
Thank
Okay,
you
question,
for
ma'am.
I
the
need your
second slides
feedback
also.
also. Okay, how do you feel? All of you. Thank you so much. We'll see you again.
Thank you
Can you
very
Ma'am,
show the
much,
second
ma'am.
slide,
Yeah.
please?
doubt, please.
Yeah.
Hello,
Any other
ma'am.
Ma'am,
doubt?
very well
Anyone? Yes.
explained. Yeah, a lot
Huh?
of doubts
Uh,
cleared and very well explained. Yeah. Thank you so
Thank you, my
much.
dear. Thank you. Thank you so much. Take care and
ma'am,
bye
a
bye. Okay.
question.
Bye. Bye.
Thank you, ma'am.
Thank you, ma'am.
Thank you, bye.
Thank you.
Hello, ma'am.
Yes.
Last doubt, ma'am. Please, I'm sorry. So, if the patient has not taken influenza in the preconceptional clinic, we are asking. So, then can we ask the patient to take influenza vaccine
Yes,
as
yeah,
even after the pregnancy? Yeah. Yes, ma'am.
yes, yeah. Influenza vaccination they can take. There is no harm.
Okay, ma'am. Thank you so much for the class.
Okay, my dear. Take care.
Ma'am, one doubt, ma'am. If the patient
Yeah.
says that she has not taken rubella, should we ask for rubella infection in the past and only then we have to give the vaccine, no, ma'am?
No. Don't go into detail. Simply you ask, are you up to date with your rubella vaccination? If she say yes, okay. If she say no, simply tell that you can take rubella vaccination after doing your blood test. And then after rubella vaccination, you need to avoid the pregnancy. And then you plan the pregnancy at least after 1 to 2 months. Check it is
Okay,
1
ma'am.
month or
So
3 months. Yeah.
after doing blood test, we will do give
1 month.
rubella vaccine. Okay,
Yes.
ma'am.
They will check the immunity status.
Okay, ma'am. Thank
Okay.
you, ma'am.
So generally, in all preconceptional patients, we need to tell them to take rubella vaccine, right, ma'am?
If they have already taken, then no need to say. If they say no, then check the rubella status first. If it is less IgG, then means you can give and avoid pregnancy. Clear?
Yes, ma'am. Thank you.
Okay. Thank you. Thank you so much.